Hello, this is Dr. Stanley Lang, and welcome to this video, which is on the topic of, is the ketogenic diet safe in the long run? Some people would want to know, is the ketogenic diet safe in the short run too? But this is more addressing the long run question. And the reason I wanted to talk about this is because it came up with a patient family today. One of the couple has been on the ketogenic diet successfully, and for the first time in his life, he has been able to have successful weight loss. And he's had a dramatic decrease in pain. He has a dramatic increase in energy, a dramatic decrease in brain fog. And so overall, a pretty good experience for him. But the spouse of this patient, who has not wanted to give up all of the foods that are part of the ketogenic diet, has some worries about whether it's safe to use this diet for the long run. And so that discussion led to my decision to share a little bit on this subject with this video. If you stay to the end of the video, I will talk about the most important question that is raised by people that do not recommend the ketogenic diet, and why I think the evidence leans towards the conclusion that I'm going to share with you. And this is the question about whether it's good for your heart and whether it causes atrial fibrillation, which is one of the most common rhythm disorders that happen as people get older. So that's at the end of the video if you stay for everything. But basically, what I wanted to reassure this patient's spouse was that it's completely safe to stay on the ketogenic diet long-term if it's done in a safe way. Well, what does that mean? Well, you still have to obey the rules of good nutrition when you are following any kind of a diet. And I'm not going to get into the weeds here, but it's critical that you eat the ketogenic diet in a way that covers all of your basic micronutrient and macronutrient needs. Now, the idea that we need all of those carbs is a myth that has been pushed on people for 50 years because of really bad science and really clever marketing. Now, that doesn't mean that everybody that promotes the idea that we need to eat all the carbs that are currently part of the American diet, that they're bad people. They're just misinformed. I was misinformed. So I'm part of the crowd of misinformed people. I just happened to stumble on some information that led me in a different direction. And so for the last several years, I've been teaching patients how to do the ketogenic diet safely if they want to. I don't push it on anybody, but I offer it to people who have the health goals that are often behind people that want to follow the ketogenic diet. The most common one, of course, is weight loss. But there are other big ones that people have, including they want to have a lot less pain. They want to have a lot more energy. They want to have a clearer mind. They want to stop their dementia from progressing. All of these are reasons that people are choosing to be on the ketogenic diet. And the biggest one, no pun intended, is that people want to reverse diabetes, which has become an epidemic. So when people talk about the ketogenic diet not being healthy in the long run, the context is that we have an epidemic of diabetes in our country, with over half of people over age 40 now pre-diabetic or diabetic. Now, anything that could reverse that is going to have a powerful effect on overall health of the country and on individual health too. But basically, I just want to talk about some of the things that I found when I did a search. I thought, well, for the fun of it, I'll just see what the internet says, what Dr. Google says about this question. Is the ketogenic diet safe in the long run? Because 2 years ago, there wasn't too much being said about it. To my surprise, I found that there was all sorts of things being said about it, but not to my surprise, everybody was using the same talking points. And it was very clear that there is a concerted effort to demonize the ketogenic diet, because most of what you're going to see on the first 2 pages of Google is negative stuff. And most of the folks are repeating the same talking points. The first and biggest talking point is that it can cause an increase in heart rhythm problems. And that's the one I'm going to save to the end to talk about. The second thing that is mentioned is that it'll affect your exercise in a negative way if you're serious about exercise. Now, this is true in the short run, but false in the long run. And so that's the problem with these sites that give negative feedback about, or negative comments. They never give enough details. They just give overview information, enough to frighten people. But if you follow the ketogenic diet in a healthy way, you will have a significant decrease in your exercise ability for the first few weeks. But if you stay on the ketogenic diet for several months, by the end of 9 to 12 months, you're going to have more energy for exercise than you had before, more sustainability with endurance exercise if that's your goal. So you can do all the exercise you want to stay really healthy if you're the average person, but if you're an elite athlete, it might take you 9 to 12 months to reach the same level of performance that you're at right now. It's different for different people, but to say that it's going to have a negative effect on your exercise ability, that's not true. It's only true in the first few weeks as the body is getting used to having ketones for fuel instead of glucose for fuel. And that transition is called becoming keto adapted. So becoming keto adapted during this transition, lots of things change, but they're temporary. So the next thing that was mentioned was that if you don't have a gallbladder, you definitely shouldn't be on the ketogenic diet because there's way too much fat and you won't be able to digest that. And that's not true. There's lots of people that I know who have been on the ketogenic diet, and I know a couple really well who have had their gallbladder removed and had no problem consuming the ketogenic diet just because of all the fat there, because the body's still making plenty of bile. The gallbladder is just a storage organ so that it can squirt out a lot of bile when you consume a lot of fat. Well, there's so much backup within the body that it's got plenty of bile for most people to digest the fats that they consume. Now, certainly you can overwhelm the system with too much concentrated fat all at once and develop a lot of symptoms. But what I am saying is that it is very possible to do the ketogenic diet long-term and in a healthy way if your gallbladder is missing. Now, the next one was almost ridiculous, which was that if your triglycerides have been high and you've had pancreatitis, that you should not consider the ketogenic diet. Now, triglycerides are elevated because people are eating too many carbs. So the solution to decreasing your triglycerides through the diet is to cut back on carbs. Now, I have a lot of patients that do this very successfully without going on the ketogenic diet. They just cut out all of the high glycemic carbs. If you cut out all of the high glycemic carbs, your triglycerides will drop like a rock. If you go ketogenic, you're just cutting out even more signals to raise the triglycerides. So if you've got high triglycerides, that's just one more reason to be on the ketogenic diet if you want to do something about it. Now, it is true that some people, their cholesterol levels will rise on the ketogenic diet. About a third of people, their cholesterol levels will rise, and some of them will rise a lot. But this cholesterol is not dangerous because it's not inflamed, it's not damaged, because the people following the ketogenic diet aren't eating the garbage that causes cholesterol to get inflamed from the foods that people eat at the same time as the stuff that causes the body to make cholesterol. So if you got high triglycerides, the ketogenic diet can be a very effective way to treat it if you want to stay off or get off of medicines that you might have been stuck on because nobody told you that it was your carbs that was raising your triglycerides. So another thing that was mentioned in all of these articles was that people will inevitably develop nutritional deficiencies. And I thought this was hilarious because the average American diet, the standard American diet, is so nutrient deficient that it's laughable to call the ketogenic diet nutrient deficient. I'll just suffice it to say is that if you do the ketogenic diet in a smart way, you can get all the nutrients you need. And there are very effective broad spectrum nutritional supplements, we call them vitamins, that people can take to cover the bases if they want to. So there are many people on the ketogenic diet that don't do nutritional supplementation. I personally recommend it, but I also recommend it for people that aren't on the ketogenic diet because I consider our food to be so nutritionally inadequate that covering the bases is part of a principle that I recommend to people if they want to maximize their chance of having good health. Now, the next thing that was said was that it'll affect your digestion in a bad way, and that's simply not true either. As you start a diet and stick with it in a healthy way, you will develop patterns of digestion that are appropriate for that diet. In other words, your biome will evolve. The bacteria will evolve to match what you're consuming. The question is whether you're eating healthy versions of that diet, which means, are you eating organic? Which is the main question, and which is one of the things that I definitely recommend on anybody doing ketogenic. But I also recommend it on anybody not doing ketogenic. So the next one was also the next thing I wanted to mention that was described as a definite problem for people was that they would have less energy. And again, for the first 2 weeks, yeah, you're going to have less energy. There's no question. Maybe 3 weeks, but by week 4, your energy levels are going to start shooting through the roof. And by 2 to 3 months in, you're going to have way more energy than you had any time in your life if you've been eating anything resembling the average American diet. So the last thing I wanted to mention here has to do with this issue of the atrial fibrillation issue, the risk of increased risk of atrial fibrillation. And this is a perfect example of people drawing conclusions from really lousy science, and then making an extrapolation to something that isn't even close to what the science that was done showed. So this really lousy science divided people into 3 groups that were either high, mid, or low glycemic in terms of their carbs. I'm sorry, high, mid, or low carbohydrate. But the low carbohydrate folks were not even close to what you'd have to do to be ketogenic. So all of the conclusions they drew from the so-called low carbohydrate folks that had an increased risk for atrial fibrillation, that you can't apply somebody that's got a 35% carbohydrate diet to ketogenic, because you can't get ketogenic on a 35% carbohydrate diet. In other words, there might have been an increased risk of atrial fibrillation with that group, but the way that the study was designed, I'll just tell you, it was really bad science. But even if it's true, you can't extrapolate that to the ketogenic diet, because to be in ketosis, the average person has to be eating a whole lot less carbs than that. Like they're down or getting around 18 grams of carbs a day to stay in ketosis. So it was a false way of dragging people into this idea that a ketogenic diet increased your risk for atrial fibrillation, when in fact, the ketogenic diet is healthy for your heart. And why is that? Because it decreases the thing that has been proven in the most recent research to be the biggest driver of cardiovascular disease, which is insulin resistance, which means high insulin levels. And on the ketogenic diet, your insulin levels will drop to the lowest level possible, because your body doesn't need very much insulin, because you're not making very much sugar from your stored fat. Most of the stored fat is being made into ketones, and just a little bit is being made into sugar for the few cells in your body that are glucose dependent. So this idea that being on the ketogenic diet increases your risk for atrial fibrillation is a total lie. There's not a shred of research to suggest that. And even the conclusion that eating lower carbs increases your risk, the way this research was done was so bad that it's just laughable. But it's instructive that you have specialists from very high-powered institutions, big names, pontificating on this stuff, and they don't know what they're talking about. Now, I'm just a lowly family doctor, but I've studied this a lot. There's a lot of information, good science out there, good people to talk to that know a lot about this, and they can lead you in the right direction. And I think it's sad that there are these forces at work to help to make people feel unsure about the ketogenic diet, when it's a very effective way for many people to turn their health around. And I could give you a lot of different stories, which I won't hear. You can read about keto stories all over the place. Just to say, it is, if done in a healthy way, a very good way to approach your health, long-term and short-term. Now, what I think is a mistake, and this is just my bias because there's not any research that supports this, I think it is a mistake to cycle back and forth. And that's something that some people talk about. I don't think it gives your body time to get adapted well to the state of ketosis. That's my opinion. I'm not going to go into any more details, just to say that there's a lot of stuff that hasn't been settled about the ketogenic diet. And we don't have 100 years of research on the larger population that says it's safe. But we do have at least 50 years of research that says the American diet is not safe. It's killing people. We have more disease than we've ever had in the last 50 years plus, and it's increasing, and it's in large part because of what we're eating. That's not the only factor, but it's a big part of the factor. So to pick on the ketogenic diet as being unsafe, as if our diet is safe, is crazy. So I just wanted to say that the ketogenic diet isn't something that has any negatives that have been proven yet. I think as any good science, we should gather data, do good studies, and see what are the negatives for what undoubtedly there are some people that shouldn't be on the ketogenic diet. But most of those people know that within 2 months. They just don't feel right. But here's the biggest problem. Most people that think that they're doing the ketogenic diet aren't in ketosis because they're not measuring themselves. So you can't just measure your urine occasionally and measure ketones and conclude that you're doing the ketogenic diet. If you're not in almost continuous ketosis, you're not going to get keto adapted. You're not doing the ketogenic diet. And so drawing conclusions from people that aren't doing the ketogenic diet correctly is a mistake. And if you're not getting the results you're hoping for, it could be that you're not in ketosis because you're not measuring yourself often enough. And you need to measure your blood to see what the ketone levels are, or measuring your breath through some of the tools that measure acetone levels. And if you're not doing those on a regular basis, you don't know if you're in ketosis. Now, after you've done it for a while, you'll know. But when you're first starting for the first few months, you don't know. So if you want to do the ketogenic diet right, measure. So I hope you found this information helpful. It is possible to do the ketogenic diet in a healthy way. It's possible to do any diet in a bad way. But you can do it long-term in a healthy way. God bless and have a great day.